When I worked at my first job, I was working
Mm,
as at a gym that, I was a trainer, but I was also like the physical therapist downstairs.
sure.
And it's hard to separate the two, other than the fact that there were like two different businesses, right? They had two different businesses there. But when you're working with someone, you can't like shut one part of your
Right.
education off, right? So it really helped me though, like see that the clinical aspect of being a physical therapist only ends because people stop coming in, not because people are all better, right? Ever.
Right.
We don't know what happens after people leave, and when
Yeah.
you work with people in a training, relationship, a lot of times you're with them a lot longer because they don't have an intention to leave. They don't have an intention to be discharged, and you don't have an intention to discharge them. So it becomes like this process that you get to see, how people get better, how their symptoms come back, but how it's not really about their diagnosis. It's just about the whole movement process, the whole conditioning process, and how it is intertwined.
Yeah, absolutely. I mean, there's so much, there's so much, I guess there's so many stories I come across that are, I used to do this thing, I used to run, I used to jump, I used to play, I used to lift, but then I got my back pain, and then the back pain went away. And I mean, it'll come back if I do X, Y, Z, but all I'm looking to do is this. Here, let's do this. Here's what I want to do. My
Mm,
goal is, and it's nice to go like, all right, man, I got you. We're going to hit your goal. But like, real talk, we're also going to start lifting. Like
yeah.
we're going to just go
Right.
right up that continuum.
Yeah.
It's a nice luxury, I
Yeah.
guess, to go like, all right,
Cool.
man, I'm glad you're aiming for this high, but we'll get you that high. Don't worry about it. Let's start the plan,
Awesome.
because it's
Yeah.
that same thing.
Cool.
It's not a clear defined moment of like, all right, now we hit this charge. Like, no,
Right.
no, man. The whole thing
Exactly.
was load tolerance. Well, now let's do more load, like
Right.
100 pounds more load. Like, let's do a whole lot of load. You know.
Yeah.
Yeah.
Yeah. And I remember someone telling me, it was a therapist, that like physical therapy is like one of the only healthcare professions where we actually discharge people. I don't know if it's like that in chiropractics or not, but like there's like a need for discharge based on like insurance regulations and things like
Mhm.
that. But you think about like your physician or anyone that you've been seeing, like they don't discharge you. You just go to them when you need them, and if you don't
Right.
need them anymore, but there's not like, there doesn't have to be this point where we like write in the chart like, okay, this person is discharged, and that's something that is like necessary in the paperwork of physical therapy. So it becomes necessary in the education in a way where it's like you have to write exactly how many weeks you think this person should do
Right.
before you discharge them. And that mentality, I think, becomes, it just seeps into the education, where now you can't think any other way but like that there's a 6 week process or a 6 month process, whatever it is, as opposed to an ongoing process.
Yeah. Yeah, that's interesting. I've never thought about that before, but you're right. Like, it's not like your dentist is sitting there like, all right, when is the job done? Like, like you said, your primary doc. It's like, oh, you came in for this one complaint. All right, man. Well, I'll see you. Who knows? Maybe you won't need me anymore. Like, nobody else
Right.
does. That is
Yeah.
funny, and it's such an ingrained talking point. Like in the chiropractic world, at least, the dynamic is like, hey man, these chiropractors, they tell you got to come in for forever, versus like, hey, we're the type of chiropractor where we're going to treat you, and then I don't want to see you anymore. And
Mm,
it's you're right. Where you stand on the discharge topic is such a huge definitive thing. That's so
right.
funny. I never thought about that, but you're right. Like this, the way that you practice, the way I'm trying to practice, you're right. It's this thing of like, I'm going to make you strong. And that definition means a lot of different things. So
Yeah.
making you strong is going to mean a lot of different things. But yeah, no, I like that idea that like, well, there's nothing to discharge from, dude, because we
Yeah.
just got to make you capable of like doing more play, more work, getting more done.
Yeah.
Like, what are we going to discharge from? I don't know. What's that thing we're going to stop doing?
Right. Yeah. And it's an education process as much as anything. And hopefully, if you have enough time under your belt in schooling, then you will know more than your client on an ongoing basis, right? So then you will always have something to offer, and I think that's the thing that I've gotten from, the blending of physical therapy and personal training is that I have something to offer until my clients tell me I don't, right?
Yeah.
Like if they feel like they want to keep coming in because I'm either I'm giving them a structure or I'm just giving them information that they didn't know that they needed in many ways, right? Because I'm looking into things that they're not because they have other jobs, right? So I think that's where the whole kind of continuum of fitness and why there doesn't need to be this need either of saying, okay, I'm the type of practitioner that says I want to only treat you a couple times and then send you off because I feel like I'd be wasting your money if I had you keep coming back in. Like that's a mentality that you hear too from, like the quicker I can get them out, the better I'm doing my job. Well, maybe it depends on what you think of as your job, right? Like that also means that they're not coming in and being educated by you anymore. So that could be a problem too. If you think of your job as somebody who's a fixer as opposed to somebody who's an educator, there's a different process of how you would view discharge or I wouldn't want to force someone to come in. I don't want to trick someone to come in, but I do think that there's a value, like an ongoing value to having like a movement consultant, because you would assume that the education that person went to would be giving you something that you wouldn't be able to get yourself. Right. And I mean, and that's how I'm viewing, my job at this point, where the whole idea of the clinical model of like discharge is just, it's gone, right? Like it's unnecessary. It's whatever the client wants it to be. Right. Yeah. And that, so if they don't want to come in frequently, then I don't care. You know what I mean? It's like, I'll try to do the best I can. I'll be open to conversations outside of actual like one-on-one sessions, but they don't have to come in and they'll get as much as they get out of that. But if there are people that want to continue to come in, I think I'll be able to give them value in that.
Yeah. Yeah. It's interesting because part of part of my mindset, part of my clinical philosophy, if you want to call it, part of my ethos, right, is like, look, man, you're going to be in pain again. Like, I'm not doing this thing where I'm going to give you the magic hands and I've now eradicated the concept. You're going to be in pain again. But, how that kind of comes back to this is like, it's always going to be that idea of the envelope of function, that graph, right? You're always going to have some weird thing come up that's going to push you close to a little too far. And actually, just today, I'll tell you what happened to me. I'm in a stretch of a block of my own training that's very volume heavy right now. And so yesterday's deadlift day. Today's just active recovery. Going to go on a little, hike with the family later. Today's laying low. We ordered some towels for the bathroom. Towels come. They're very heavy. Moved the towels inside, mowed the grass, big steep hill, pushing the lawnmower, and then I swept some of the grass from the sidewalk back onto the lawn again because it's like, the public part of the sidewalk. I don't want it to look dirty. Give it a little sweep, and my back's like, yo, all right, man, that was some hard work you did pushing that broom. Something's always going to come up in a wacky way and kind of have you dancing with that top line, on that little window, on that little gap, that nice little envelope where we want to be. And so there's always going to be a need to throw different stresses at you. There's always going to be a need to make stresses not novel or less novel, or, have felt what it's like to bend and rotate once before in a controlled setting. Right, rotate and twist, and so you're going to feel pain again. We know that's true, but the more that I can do to expose you and throw controlled stresses at you and make you capable of doing work, there's no discharge from that. That's just the thing we're going to do so that when pain comes, you're feeling really good and you're not scared by it, and you know what the deal is, and you can give me a call.
Yeah, and I think another thing that you're bringing up there is you have to be the example that is going through different movement practices, exploring yourself, so that you can have your own injuries or pains, that whatever you want to call them, and have a little bit more of a common ground. But hopefully that discussion on pain is you're doing things that are actually a little bit more exploratory than the clients that you're working on, because you have more of an understanding and an education on how the body works, how the pain process works. So that, like, there's not this idea that somebody's hurt. Okay, they have a very specific diagnosis that needs to be treated, and if it's there, then it's sort of like a stopping of all function. It's more like you've experienced pain in your own training. You know how to fit pain into your continued training in a way, right? Like how to work around it, how to veer around it. And that, I think, becomes a really important experience to have, that you can then pass on to the client. That they understand that, yeah, you've felt similar things, but maybe for different reasons, but that it isn't just this, like, if you have pain again, that it's an end point, or it's like, okay, I got to stop and I got to go to some other treatment before I continue. Like, you're part of that process too. Pain just fits into the continuum of movement, because pain is it's always subjective, right? Like, what somebody is going to feel is painful is going to be different for each individual. It's not going to be based on the activity necessarily. And that's where it's like, you don't necessarily know as the clinician either what's going to provoke someone's pain, other than having, just a body of norms to work with and saying, like, okay, this person seems their symptoms seem very irritable, so I don't want to push them. But you don't know. Sometimes you did a little more than you think, and the next day you get the phone call or the text message that, this hurts. And that happens, I think, less with experience, but because of the subjective nature of pain, you realize that it's almost unavoidable, right? But like, you just get better at, kind of fitting the person that you're dealing with, and with the, how safe and how, even the terminology that you use, like how you kind of confer with the person to make sure that you don't have that happen. But it's just like, you don't know, and you don't know that with yourself. Like, sometimes you're surprised with the stuff that brings on pain. And it's nice to have an exploratory movement practice to be able to have that common ground with your clients.
Well, it's funny. The thing I love about that is what in a sense, what you're describing is kind of like sort of the pain coach. And what I mean by that is that moment where maybe they're working with a strength coach, maybe they're working with a specific sport performance coach, whatever, and they have that moment of like, oh man, like I was pitching, and my shoulder got a little sore, or I was doing deadlifts and my back got a little sore. And there's an ongoing place for a professional to be able to step in and go, hey, no, dude, we're not taking off deadlifts. That's not what that means. Like, this is now my job. My job is you come in here, you talk to me about that experience. I go, no, that's not the thing. Here's what the thing is instead. Yeah, that very much should be an ongoing relationship. So twofold, right? One, on a performance level, that you're not losing out on, hey, we're taking recovery from nothing, right? Recovering from nothing happened, downtime you didn't need to have. But also, and again, I don't mean to be the broken record, but, to avoid letting those fears creep in, those doubts creep in, those concerns. What is the pain? What is this? What does this mean? Let any of that creep in. Like, no, I got you, man. I know what that means, and it doesn't mean catastrophe. Don't worry about it. Here's what we're going to do.
Yeah, absolutely. Yeah, and I think, like I said, it's something that you as the professional want to be exploring yourself.
Yeah.
And I think if the more education you have and about pain, and you can see this in the literature now, it's like education matters. Like, understanding the pain process matters in that you'll get less intensity and less duration of pain for, the same structure inside. If you look at, a radiograph, or if you look at an MRI, and for, the same type of activities. So you having the higher level of education should be the best person to be able to explore more activities. But you also have to appreciate that you may experience things different because of that education, right? So you can't, progress people the way you progress yourself. But I would rather be the professional that has touched more things than is afraid to touch those things, right? Because I feel like you understand the process to get there, but you also hopefully know how to be very gradual with that process and put people wherever they're ready for.
Yeah. It's funny. I in a few of these last few sessions, I know at some point we had talked about I was having some knee pain. And it was interesting, I said in response to this knee pain, I'm going to take a little deload, and I took a deload and it's fine, and it worked. It did what it's supposed to do. But it's what you're talking about of experiencing pain, of engaging in a little bit of an exploratory sense, touching upon and feeling that pain. Like I've definitely, it's funny, I feel like I've had moments where I've been like sitting in a chair and my knee pain will start to hurt, and I've had this feeling of like, oh, interesting. Like this would scare me if I didn't know knee pain. Like I understand, like it feels sharp, but like I'm fortunate enough to have the education I have, and it's good, in the sense of actually being able to coach someone. And actually, I'm like, no, I know it's sharp. Like I know what you're, don't worry, man. I know what you're telling me. Here's what we're going to do. We're going to go less intensity, less volume for a little bit, or whatever it may be.
Right.
But yeah, you're absolutely right. Again, just kind of like pain coach, having a guy to go, I got the answer. The only thing is you just need info. I got info. Here's what it is. Here's what you do with that info.
Right. Absolutely. And I get that way all the time, where like I'll have something that pops up that doesn't feel that threatening, but it's definitely something that I have to like be mindful of and veer around. But I'll go to that place where like, what if I was like a client who had just no information about pain? Like, how would this feel to them right now? And I guarantee that it would be a lot scarier. Or even if you're somebody who you can't change your activity as much as maybe you and I can. So like when I get a pain, I know that, okay, I'll just do something else. I don't really have to change my training goals. I just have to like maybe do a slightly different movement. Right. And that is something that I think is a valuable thing to teach, like the general population, is have many options for the same fitness intent so that you don't have to use the same patterns over and over again. And if something does pop up, that it's easy to just veer around that. However, what if you are a laborer who has to do the same activity over and over again? What if you're an athlete that, you really have to do the same movements over and over again? Those become different discussions, and the pain becomes more threatening, right? And it's not necessarily even about the intensity of it. It's about the fact that like you can't do the same thing you want to do. You don't have the freedom to make an adjustment either, or like you can do that in training, but you can't do that on the big stage if you're playing. So I think it's important to have these things pop up, but then also take it into the perspective of either the newbie who just is like totally like thinks that any pain is damage, or somebody who, the discomfort of the pain is not really the issue. It's the, taking away from the performance that they can't actually afford to take anything away from. And those become just totally different experiences.
Yeah, or even I'll take it a step further, or even the catastrophizing of, let's say, like the painter, the interior painter, right? Like it's not even, hey man, the pain, it's what this really is it's something that will separate me from what I love to do. Like not even that on a sport level. It's a step further. It's the catastrophizing of, hey, the pain means this is the rest of my life because this is what I do. Like there's no eventuality where I don't go to work. So what this means, I guess, this is just my life now, And just having, again, the coach in the corner, they're like, dude, this is not your life now. Don't worry, man.
Right.
Because there's definitely a difference between, that was interesting. That's a little painful. Maybe I should try this different variation. Or, man, I think I felt my whatever do whatever in bad technique. Hey, let me go use this other equipment for the, I'm going to change up my programming for the next week. There's a difference between that and, that felt weird. And now it's just the wild damn West. I don't know. I was just going to change everything.
Yeah.
You know what I mean? Like those are two wildly different thoughts for sure.
Yeah, and what you described there is one of the reasons I think it's so important to have an education, both as somebody who understands the body and understands pain, but also somebody who understands like programming and activity modification, but also like what someone might have as an intention in fitness, which I don't actually think I got at all going to physical therapy school. Like coming out of physical therapy school, I didn't have any education or very little education on programming for the goals of fitness. Like now I only think in those terms in many ways, but it's been through continuing education where it's like, okay, what would you do if your goal is strength? What would you do if your goal is speed? What would you do if your goal is endurance? And then, how is that different for an athlete versus someone who's in the general population? And I think like one of the most important conversations to have is just to make the category that somebody wants to attain more broad, so that they don't have to do the same damn thing that's hurting them all the time, and that it doesn't become so threatening, because you're just like, okay, like you have to do a little bit less of this. You might not even have to do a lot less of this. You just have to do a little bit less of this. So let's not do less in general of the thing that you want to get out of fitness. Let's just add something else that isn't threatening to your body right now. And then over time, that actually builds a more versatile human. So this concept of movement variability, which we've talked about multiple times, is really important, like to educate somebody on, is that like you, even before the overuse or the pain would get there, just to say like, is there more things that you can do to build, more versatility in your movement patterns? Because you're going to feel better if you're more versatile. Like if you don't have a very specific sport goal where you have to train the same skill over and over again, which most people don't, but they train like they do in a way, because it's easier to train like one or two things over and over again. And maybe, people had a background as being an athlete and that was the thing to do. But just to break that habitual nature of kind of training the same couple activities over and over again, and seeing the progress with that, breaking that habit and just saying, okay, let's have this be a more broad category that we fit more things in. And that could be huge to when the time comes that something does pop up, it's not as scary because you have multiple things that you can do to accomplish the same goal.
Yeah. Well, even the things you're talking about, it's funny because, talking about, hey, let's change this this exercise choice. Let's try this on a temporary basis. Let's take this away for a bit, decrease your volume, replace it with that. You get to have those conversations if you already know the fundamentals. And I will tell you this I can only speak from my experience. So I won't speak for, all, movement pros. I won't even speak for all chiropractors, but, man, I'll tell you, like, I feel like I didn't even know the, basics, the fundamentals as a chiropractor. And what I mean is like, I knew how to look at a squat and sort of go, hey, the knee's moving pretty well. The like in isolation sort of, or the concept of the hip is moving well, but in terms of like, yeah, but you're trying to do something, right? Like if you're squatting, you're trying to pick something up off the ground, or you're trying to, maybe you got a bar on your back, like you are trying to accomplish something. And so like, it's not just observing, all right, his butt's going down, his butt's going up. As his butt went down and up, what did his knees look like? What is like? There's not this isolated thing. You do want to make sure you are getting the most you can out of your quads. You do want to make sure you're playing to your strengths, whether you're stronger in your back, your glutes are stronger in your quads, whatever it may be. Right? This is part of it, and I feel like I didn't know how to really assess movement meaningfully until I really started to dive more into strength science, because it's a whole thing. There's this thought of like, I know how to look at a squat. I know how biomechanics. I know, exactly how things are supposed to be. Yeah, man, but you don't have the performance piece, and that's huge. Right. And that's this person in front of you is trying to accomplish a task. If you're just going in vacuum, that was a good movement. You're missing a lot. So you can't even start speaking to volume. You can't even start speaking to variations. And you go like, all right, but do you understand strength science? Do you understand athletic performance? Do you understand getting that adaptation? If you're not studying that, like, there's a huge gap in your ability to help people.
Right. And hopefully the two worlds come together in formal education. But I would say the good thing for, physical therapy and chiropractic is it seems like we're blending now with our continuing ed, is that there is a really good world of continuing education out there. And I think that'll start to bleed more into formal education too. I think it has to, but it's just that it's slow, and we're both kind of in relatively new professions. Like they're continuously evolving, so which is kind of cool.